Thank you for hosting us. Thank you for the introduction. I really appreciate the Fulbright experience from the day that I was accepted to go until today, and I keep being really surprised, happily surprised of how amazing, how energetic, and how really we're open for networking, and I'm always excited to come to these meetings. Without taking you further, the topic of my conversation today is focusing on the nutritional status, particularly the food and nutrition security of refugees and host community in Lebanon. And I'm going to kind of go through a bit of a quick kind of snapshot of what I'm doing, why I'm doing what I'm doing, so a bit of a background of what is food and nutrition security, and then what are some of the research projects that I'm currently being involved in. So trying to build a story rather than digging into one study per se. This is where I just flew from Beirut. Literally, this is how the weather was. But I can't say that to people from Egypt. They have even more amazing weather. And I'm more specifically in this area in particular. Last year, this is where the Faculty of Agriculture and Food Sciences, where I'm actually an assistant professor, and I'm also the co-director of the Refugee Health Program, which is something all across the campus of UB. Last year, we actually celebrated the 150th anniversary of my alma mater, so it's always good to be back as a teacher and researcher in an institution that you also graduated from. My research interests have always been about children and youth. However, when I came back to Lebanon after my Fulbright experience, one of the things that was going on, which was basically the Arab Spring, and I could not, as a community nutritionist, but think and feel what was going on in terms of Lebanon and the refugee situation. So this focus of my talk today will be really, excuse me, I'm just gonna monkey around with this, will be really on the first topic, which is the assessment of the food and nutrition security of vulnerable population groups. However, I do have interest in developing and testing community-based nutrition education interventions, as well as assessment of dietary intake of young adults, so basically university students. So when I say food and nutrition security, what does it mean? And I know that I'm after really nice presentations, and you were just talking, Sami, about food biosecurity, so it's a bit different. Food security, in definition, according to the World Food Summit, it's when all people at all times have access, physical and economic access, to sufficient, safe, and nutritious food that not only meet their dietary needs, but also meet their preferences, their cultural preferences. So that's according to the World Food Summit. Now, this is a very big definition. It has a lot of components. What really this concept is built on are four main pillars. The first one, which is what most agriculture people like to focus on, and what the majority of the work on food security up till today is still there, even in Egypt and in the MENA region, the focus is always, when you talk about people being food insecure, we think about, is their food available or not? And that's also a problem that we face in developed countries. So, for example, do we have enough production of wheat? Or do we, for example, have enough stocks? Or do we have a humanitarian aid? That's a problem that any country in the world should always think about. Are we food secure or not? So from the availability dimension, it's quite clear what it is. The access dimension, which is something that was actually added to the definition of food security, was in the 1980s, when people realized that it's not sufficient to just have food being produced. You could have it just literally by you, but you can't actually access it, either because you don't have the economic power to do that, or you don't have the employment, or simply you actually have a market, but you don't have the transportation mode to make it there. So that's the component of access. And then you've got the utilization, which is very close to our heart as nutritionists and public health professionals. That's where we talk about how is food being utilized. Do you have the knowledge, the adequate knowledge, and the feeding and care practices for young infants and children? Do we have good water and sanitation and hygiene in terms of ensuring that the health status of this population or this community is adequate so that they can utilize the food? So you could have the food available, you could access it, but you could consume it and you wouldn't necessarily benefit from it because of diseases or because of the fact that you have poor sanitary conditions. And finally, this very important dimension that without it, none of them would exist, it's the stability. And it's economic stability, it's social, it's political, and it's, of course, when you talk about seasonal and weather. And this is very important when today we're talking about climate change and its impact. One of the very important things that really affect food insecurity, and we're just talking about that, is stability, right? That pillar. Well, when we talk about wars, it's basically the lack of, or the instability. And this is going to be no surprise to us that when we talk in the MENA region, for example, about the food insecurity situation, it's definitely because of a lot of these challenges. But one of the major issues is this increased risk of conflict or the actual conflict, which led to political instabilities, population pressure, migration, and of course, adding to the bad governance, high levels of poverty and whatnot. So the Arab Spring and the health. What are the short-term direct effects that we've been seeing? We definitely saw, and we still see, unfortunately, violent deaths and injuries. We're seeing population displacement within the nations and to neighboring countries, and some of them are actually even moving and, by sea and going through to Europe and to the US and to Canada before the closing of the borders. And then you have the long-term indirect effects, which include rising of food prices, which is there where you start thinking also food insecurity, erosion of already weak welfare programs, the low status of women, I know you're going to cheer for me, Samia, and the high unemployment rate, which also adds to food insecurity. So today, when I'm talking about my work, I cannot but think about, okay, what is going on in terms of this region, right? So Arab Spring is happening. One of the largest disasters or humanitarian disasters is still ongoing in Syria. And what does that mean? Almost 4,863,000 individuals are either between Turkey, Lebanon, Jordan, Iraq, Egypt, Libya. That's not to mention those, as I said, that went all the way to the developed countries. Lebanon alone is considered to be one of the highest per capita concentrations of refugees. And I'm saying that because, of course, when we think the numbers here that I'm showing are only for refugees that are Syrian refugees that are registered. This does not include unregistered refugees, which are plenty because they worry that if they register, that they could be politically followed. There's also the Iraqi refugees, they're not included here. The Palestinian refugees are not included here. So this is quite a number for a population of only 4 million. So 1 in 4, and the data now every day is saying that actually there's 1 in 3 people in Lebanon is a refugee. So when you talk about that, of course, you're starting to think this is quite a burden, and we'll see how. The two regions that are the most burdened by this in my home country in Lebanon are the Bekaa, which is in the east side, and Akkar, which is the north. It's in actually the northest district, and the poorest district classically in Lebanon, even way before the crisis in Syria or in the region. So these are the rates of what are the highest proportion in terms of refugees. And in addition to that, according to the report that's published by the World Food Programme, it's recent, 2016, Vulnerability Assessment for Syrian Refugees, there's a very high burden of diseases. We'll talk about infectious and chronic diseases there. And there's also low dietary diversity reported at the household level. So what are the challenges faced by refugees? As I said, we have poor living and sanitary conditions. We have limited job opportunities and income. We have high disease burden, both the double burden of diseases, the infectious and the chronic. You can imagine how costly this is if you're coming from a health economics perspective, which we've been hearing about. And of course, poverty and food insecurity. What the challenges that are ongoing today in Lebanon is that the humanitarian aid, even though it's been pouring since 2011, it's not sufficient. And the majority of this is focused classically on the refugees. However, there was kind of social tension between, not kind of, real social tension among the host community in terms of those that are poor, that are in the east of the country and the north, that didn't actually get any food aid. So this also created even further challenges. However, it wasn't well reported early on. And of course, there's competition over livelihoods because there are limited livelihood opportunities in terms of education or in terms of employment or in terms of health, in terms of different job opportunities. There's continuous today competition between the Lebanese and the refugee. And this is something that is becoming really on the radar of all the politicians and the international organizations and the research centers like us. As a researcher, I can't but look at the limited data that I had. So I came to Lebanon. I came from a very school nutrition background, and Hori knows that because I've always been into school nutrition and policies. However, before I jumped there, I had to really look at what is lacking in Lebanon. And what was lacking is limited data on food security at the national level. So that's the first study that I will talk about. There's also the second study that I ventured into, and we're actually doing the results now, and I'll show you some of the results. I looked at Akkar, and I wanted to see the comparison between the refugees and the host community because there was no data at all on nutrition security between both groups. And there's also not much data at the individual and household level. So everybody who talks about food security, and this is a very, by the way, complex topic that I'm trying to squeeze here. We usually talk about FAO data, about food production at the national level. We talk about regional food security. Rarely do we look at household and individual level food security. So the nation could be food secure, but the households and the community may not be. Even a household could be food secure, but the women or the children may be food insecure. So studies are showing us more and more that these are problems. So the first project that I completed in 2015 was this study, the first national study to explore the food security status of Lebanese households, and I focused on mothers and children between 4 to 18 years old. The second study was comparison of the food and nutrition security status of Syrian refugees in Akkar. The third is a study that's very close to my heart. It's in the east of Lebanon, Bekaa, and it's a pilot intervention that I was looking at assessing the impact of creating health and nutrition education within the classroom, but also healthy snacks for pure Syrian refugees. This is, we're talking elementary level, and I'm gonna show you also quick results. And study 4 is something that I'm venturing into doing, which is looking at this new model called community kitchens that provides food for the refugees and the host community, and the food is actually cooked by local women who are Lebanese and Syrian, and that are being subsidized by international organizations. And nobody have looked at the perceptions and experiences of the workers there who have been empowered, who have been given jobs to cook food for themselves and for the poor families around them. So this is a qualitative study, the rest are very quantitative. So the highlights of my findings, very quickly, and this is the first time I'm very proud to do this before I publish it. This is the map of the level of mild, moderate, and severe food insecurity in my home country. So this does not include food secure. So this is people who are actually, as the red, of course, color means the severely food insecure. And this is using a measure that was validated in Lebanon, but it's a perception of food security. So this is you're asking the people themselves if they feel that they are food insecure or not. What was surprising to us is to see that actually in Beirut, which is the capital, that we could see such a severe level of food insecurity. However, when you go down to when you do data collection and you get your hands dirty, you realize that, of course, what you see on the sea and on the Rawshi and the beautiful areas and the touristic areas are not what you get to see definitely in the neighborhoods that are into the inner city. So that's something that's not surprising for people in Egypt. I assume you see this in Cairo quite a lot. Of course, we weren't surprised to see the high levels of food insecurity in the north and the east. Things are a little bit better in the south of Lebanon for many reasons. Classically, we've been receiving a lot of, I'm coming from the south, so that's why I said we've been receiving a lot of food aid and, welfare programs and supportive development projects because post the different wars that have been going on in Lebanon. What are the coping mechanisms that people are doing in order to live with this food insecurity? Some of them are really reversible, but some of them are irreversible. And I'm showing you just a sample of these. Let me see. Just from the least severe to the most severe. So the first thing you do if you're actually poor on food or you don't have enough food is you rely on less preferred and less expensive foods. That's something relatively easy. You start borrowing money to buy food from your relatives, from your friends, from people abroad. You start restricting consumption by adults in order to make sure that the kids are eating. You start limiting portion sizes, so you move from quality to quantity. You start skipping complete meals, and that's not just skipping breakfast because I want to lose weight, that's skipping breakfast because I simply cannot afford it. And then sending family members to eat elsewhere. Some of them actually marry their girls before they are 15 and 16 years old because it's a less of a person to feed, but also because to protect her from a social protection element, because we make sure that she's not, for God's sake, raped or something that is, worse. So some of those could be irreversible, and of course a lot of school dropouts which are not reported here. As a nutritionist, I can't but look at BMI, and I thank you, Hodi, for presenting it. So I'm looking at mothers. I'm not presenting the data of children because I didn't see the statistics association. However, I'm telling you that there are high rates of overweight and obesity among children. But if I just focus on the mothers, what was interesting and what I saw that's very similar to the literature is that as the food insecurity level increases, so does the level of obesity. So you can see here that the food insecure have significantly higher percentage of obese and overweight compared to the food secure households. So women who are in food insecure households are more overweight and obese, which you think, that's interesting. And then we don't only use BMI, which is one metric. Now, it's different than the children. The BMI, we don't plot it on a growth chart. It's very straightforward, weight divided by height, kilogram and meter square, and you get a number, and usually this number has different classifications, and we can tell you if you are normal, over, under, or obese. The waist circumference is even a better measure because it shows you actually an increased abdominal obesity, which is strongly associated with all the different chronic diseases that we were mentioning in the past 2 days, diabetes, cardiovascular diseases, and whatnot. Same thing. We notice a statistically significant difference in terms of the level of, this is elevated. I'm noticing that the levels are switched. This is 28 here and 22.4 here. I'm sure about that, but I think my RA just switched them, so sorry for that. The food insecurity and obesity paradox. So people start thinking, okay, why would you be food insecure and obese? I mean, we think food insecure means hungry. That's the classic method. And in reality, we look at them as basically two different sides of the same coin. There's several explanations for that. Not to bore you, these could be summarized in the following. You have limited budget, you're gonna maximize your calories with the limited money. What's the cheapest food out there? You're gonna consume it and you're gonna make sure your family is consuming it. What's the cheapest food out there? It's relatively unhealthy. It's actually the more energy dense, very low in nutrients. Second thing, you start with trading quality with quantity. First, you start with cutting your quality of the food, not eating proteins, making sure that it's fine not to eat the fruits and the vegetables. Eventually, you start cutting complete quantities. And then in times of shortage, what the human being usually does is they cope with not eating. But once there's any kind of food, what do? We overeat. And that's quite a problem because physiologically, which is the fourth element, your body does not understand like that. Your body is, by evolution, used to storing those calories and storing that fat because it wants to protect and preserve. So this could be a clear explanation, if you want, of this food insecurity, obesity paradox, if you may. And that I saw in my study. The other study in Akkar, briefly, this is Akkar. I worked in 8 villages with very high Syrian refugee load, basically welcomed so many refugee families, and villages with very low Syrian refugee load, very similar on socio-demographic characteristics, and same religion, making sure that we match each village by the other, because there's a mixed religion in my nation and in Akkar also. What we saw is that when I looked just at Syrian compared to Lebanese, you're not surprised to see that the refugees are in worse conditions. You have the worst severe food insecurity levels compared to the Lebanese. But when I compared the Lebanese households from 2 different categories, Lebanese that are from the villages where we have a lot of refugees, and the Lebanese that are from the low refugee load, I was looking in a way as like pre and post-crisis, because we had no data on pre-crisis. So this group that I'm calling the comparison group is this group that's not hosting refugees. It's kind of mimicking, to the best of our ability, a pre-crisis modality. What we saw is that the level of, and this is probably will look here better, that the level of food insecurity was higher among those that are receiving more refugees. So it's starting to give me real data to show that, this could be true, that what people are saying is not just because they want to get more money. It's in reality, it's a problem. It's affecting their dietary intake. And we moved even further because, of course, I'm interested in data, not just weight and height. I'm interested in dietary intake. So we looked at the food consumption score, and this is it's also a common tool that we use and WFP uses a lot. It tells me very quickly if people are eating adequately or not, okay, because we have so many metrics, so we summarize it somehow. And this tells us that the Lebanese are doing better than the refugees, significantly better. I looked also at the Lebanese among themselves, but let's not bore you with the data. Let's jump in. How's my time? Good. And I speak fast, but inshallah we'll be good. This is the 3rd study that's close to my heart. We are into the 2nd year of this project. It's in the West Bekaa. And we are working with 3 non-formal schools, 180 Syrian refugee children and mother dads. We have 1 control school, which includes 60 children, and 2 intervention schools, a total of 120. The first group was more of the daily snacks standard diet. So, of course, we were making sure that they are eating, but it's the classic what they are offering. We did not introduce anything new. The 2 intervention schools, we've introduced the weekly nutrition classes and the daily nutrition snacks. Now, I believe in training of trainers, and I believe in sustainability beyond me, because I will never be able to be in the Bekaa as a continuous teacher. So what we did is, and what I've been doing for the past 2 years, is I've been training teachers, and I've been training them, although they keep changing, because as you can imagine, with refugees, there's a lot of migration. People apply to Canada, and they go mid-year. They move within the same year in different places within the country. So what we've been doing is making sure that the classes are being given on a weekly basis, and that's because the schools were too excited about it. We actually wanted it once a month, but they said, no, we integrate it into the curriculum. We provided them with all the material, all the educational posters and whatnot. And what they did, and this is part of the training actually that we conducted within the schools, this is an interesting modality. I don't have much time to talk about it, but if asked, I will explain it. It's a model where you can put it on and then collapse it and take it away. It's not a permanent school. And that's a very important thing, because it's supposed to be a model for how you can create a school that you can take with you back to Syria if you're a refugee. And that's quite a problem in Lebanon, because we don't want permanent presences of refugees, because we believe بحق العودة. And that was for the Palestinians, and the same thing for the Syrians. So this is within the classrooms. The intervention included several lesson plans. These are the major ones, and you can see that there's a lot of similarities between what, for example, Huri gives and what classically what the nutrition education classes are given internationally. You always talk about importance of water and the importance of healthy beverages. You always focus on physical activity. We always focus on the importance of breakfast. That's very, very important for this age group and for this population. But what was hard and what was really challenging is making sure that this message resonates with a refugee who's living in an informal tented settlement next to me. So this person's not coming from a regular apartment. This child that I see that's walking with clothes that was given by the school, which is an NGO, is coming with their feet that is sometimes bare, and sometimes they give them shoes to wear. Really basic. So we are working with really very, very tough conditions, and you want to talk about food security and about making it, of course, as simple as possible, dietary diversity. It wasn't easy. Of course, when they arrived, everybody was inadequate on many levels, but the refugees had severe deficiencies in vitamin A, calcium, vitamin D, C, potassium, and vitamin B12. When we did the intervention, post-intervention, one of the challenges, because this data is from year 1, so I'm still collecting data in year 2, there was a lot of dropout. People left the school, either during the post because it was the season for harvesting, so they are taken to the field in order to harvest and completely out of the school. or they left the country, as I just said about migration. Those who were left, so out of the number that we started with, we left with 116. We found that there was a significant increase in total caloric intake, and that was good because of the snacks that are given in the classroom, in the school, excuse me, and I can talk about it if you're interested. And also there was significant increase in protein, and not as much with the other macronutrients. In terms of the micronutrients, there was a significant increase in the intake of calcium and vitamin A and of iron. Yep, that's basically repeating it. The control, we didn't see that difference. This is the case of the mothers of the children, and I wanted to also highlight that there is a very high prevalence of overweight and obesity among refugee women. So the talk in Lebanon up till today is, let's think malnutrition, let's talk under 5 stunting and wasting and whatnot, which is very important, but we don't have it. Let's face it, our rates are very low. What we really have is obesity with food insecurity. And sometimes we call this hidden hunger, because you're hungry, because you're deficient for micronutrients from the inside, but you look healthy and chubby and nice. You're not. You're actually probably eating from within. The BMI status of children pre and post intervention, you could see that there weren't any differences, and I'm not shocked. It was 1 year. This is data after 1 year. We don't usually see, even in the best modalities in the US, we look at this after 2-3 years to see if there are changes in BMI. So I wasn't expecting a drop, but at least we had to look at it. And finally, it's a study that I haven't started, that I am in the proposal submission phase. It's the one that I was talking about. It's the perceptions and experiences of the community workers. So finally, I wanted to say that this is all my research. I do other projects that are community-based with my students because I love it and because it's part of the duty that we do at AUB as an outreach and service. So I partner with all these great organizations. We do MOUs with them, and we have several work that we do with tented settlements. So this is actually work within the tent. This is also, this is IYCF, infant and young child feeding practices. So we talk about what's the best way to basically feed babies, and it's exclusive breastfeeding for the first 6 months and then complementary feeding with continued feeding. And this is malnutrition assessment for babies that are under 5, and we had a lot of cases that we saw. Even our students had the chance to see wasting and malnutrition and stunting. In conclusion, we have really a problem in terms of moderate and severe food insecurity in my home country, whether it's in the refugees or the neighboring Lebanese households. Even at the national level, we saw that Lebanese, even in the capital, in the cities, have this problem. Inadequate dietary intakes and micronutrient deficiencies are found, so we need to address them. Which brings me to more of a positive perspective of, let's think of it as more of areas of opportunities rather than gaps. There are gaps, and that's the first thing I think, research gaps. But we also need to think about how we could build on these gaps. So if we are doing research, if the ministries, and I know that they are, and the WFP and the UNHCR and all the different UN agencies are working on doing surveillance and monitoring, this data will give me evidence that I was talking about yesterday. It will give me evidence for practice, for the good interventions we hope. And then, of course, it should give you the knowledge for policies, because we are doing policies on a daily basis. This is not something that we parachute from abroad. It's something that every organization that came to Lebanon with the refugee crisis has realized that everything they learned in Africa and Latin America does not apply. Maybe 10% or 20%, but the majority you have to learn from within. And then finally, hopefully we evaluate whatever policies and programs we come up with in order to enhance the research agenda and the public health interventions, and then the cycle continues. So this is it. Thank you. These are my research team. I thank everyone who I worked with at AUB and in different other institutions. And I also want to thank my students, undergrad and graduate, and these are my funding organizations so far. And I'm applying for more, so hopefully there's one that I'm not including, Humanitarian Innovation Fund. So thank you.
Thank you.